Good morning to all. Dolo Doctors and Pharma. It is one of healthcare's open secrets. Scandals involving freebies to doctors by pharma companies make news with predictable periodicity. The relationship between the medical profession and pharmaceutical industry has provoked intense scrutiny and attempted regulation across the globe. India is no exception. When the news surfaced of Bangalore based micro labs being accused of handing out freebies to doctors to promote its paracetamol brand Dolo 650, it would have normally stayed trucked away in the back pages. Experts would have dismissed it as another routine chapter in an old saga. But instead, it has stayed in the headlines. There is a reason, and in this also lies an opportunity. Apart from normal samples, pens, writing pads, small printed books, hand sanitizers, and masks, no major so called freebies or big gifts have been given to doctors for the anti fever drugs. The official disclosed the statement. The Federation of Medical and Sales Representatives Association of India, whose members are directly involved in drug promotion to doctors, moved to Supreme Court with an interesting plea. Their lawyers suggested that since the market price of paracetamol up to 500 mg was regulated, the company moved to higher doses. And in a bid to increase sales, freebies were given to doctors to incentivize them to prescribe Dolo 650 mg, the higher dose. Pharma companies need to inform and update doctors about their products, but the rather thin dividing line between legitimate promotional activities and illegitimate incentivization have been much contested one. Many countries have developed codes of conduct which attempt to draw this line. In India, the previous MCA code and the upcoming ethics code of the National Medical Commission label gifting and hospitality as a unethical conduct. MNC pharma companies are supposed to be bound by internal codes. FMRAI is asking Supreme Court for early implementation of the Uniform Code for Pharmaceutical Marketing Practices, which is currently a voluntary code on paper. The Apex Court has agreed to examine their plea, seeking direction to the center to give teeth to UCPMP by making it law, thus ensuring an effective monitoring mechanism and transparency as well as punishments for violations. COVID has created a sense of urgency for collective action on healthcare. It has made ordinary citizens acutely aware of the dangers of unregulated healthcare. Drug prescriptions and costs are arousing suspicious. Take bizarre prescriptions of antiviral drugs in COVID. Fear of an unknown disease and the lack of evidence-based practice culture in India may have contributed, but this was largely shaped by disingenuous marketing by pharma companies. Of course, with willing partners in the medical profession. The medicine which provide relief from the fever and throat pain of COVID for millions and the safest and cheapest drug for this purpose is paracetamol. Whatever the reason, the medicine once synonymous with crocin has slowly become known as Dolo. Thank you for watching this video. Please kindly like, comment, share to your friends. Thank you very much.